Hello, everybody. So, for Block 3, Question 1, what skills described in Chapter 7, identified on the Leadership Skill Questionnaire, would you use to secure needed resources? So, in the Leadership Questionnaire, I scored high on all three, with interpersonal being a slightly higher at 24, and administrative and conceptual skills being tied in between. So, in Chapter 7, the leadership skills that I would use to secure needed resources would be planning, organizing, staffing by providing appropriate and adequate staff to provide safe care for the patients, directing, which would include communication, definitely being a very good communicator with staff, giving clear directions, supervising them, and being a good listener. Coordinating, which would assemble personnel so they would function harmoniously to attain organizational objectives. And controlling, which is just to ensure tasks to be accomplished or appropriately executed. Question 2, how would you use the published literature in the process? So I had Resistance to Change in the Nursing Profession, Creating Transdisciplinary Solutions by Carrie S. Clark. And in this article, it just showed how nursing together has struggled to realize the caring aspect, and that is the essence of nursing. And that our profession puts more emphasis on technology and those kind of resources. And when you have a transdisciplinary approach, you take into account the values and ethics, and it embodies lived experiences within the profession. So the author, Carrie, she was going to school getting her doctorate degree and was a teacher in a university, and she saw that there was a lot of resistance to change in that area that caused nurses and new nurses students to develop burnout and to just stop their profession altogether. So she just went on to try to improve the areas in her education of her students, and she noticed that there was a resistance to change. So what had to happen was overcoming fear and mistrust to promote change to create a holistic approach to nursing. So how I would use that as a manager, I would promote a team approach, and because all nurses, all people that work in the organization have different lived experience and ethics that can all be blended together to create a change and better outcomes for the patients. Question number 3 was identify the levels and departments you would need to work with in order to be an effective manager. So I work in the emergency department, and I've been a nurse for 12 years, and I've worked in the emergency department for 8. So we work with the entire hospital, basically. So we would have admitted patients. We would work with hospitalists very closely to coordinate care of the admitted patients. The directors on the units, ICU telemetry, and the medical units to ensure the patients were getting admitted in a timely fashion. We would also work closely with the surgical units because we have patients that we transfer to surgery. We'd work with radiology. I'd work with laboratory, clinical administrators, which would help with transferring patients and bed assignments. EVS with cleaning the department, distribution for the supplies that are needed on the department, maintenance for any problems with equipment, transporters to transport patients to radiology or upstairs to their admitted area. Number 4, explain if you feel you would have a preference for vertical or horizontal structure and a particular model. I think horizontal structure is probably the best. It's more employee-centered approach with emphasis on teamwork and collaboration. And a model that was in Chapter 7 is the job design model, which supports nursing autonomy. It includes nurses in policy making and strategic planning and monitoring of quality patient care. So that's all I got. Thank you.